on scope of integrated medicine in cardiology, I invite Dr.VP Nair, cardiologist with more than 3 decades of experience, currently practices out of his clinics at Mount Elizabeth and Mount Elizabeth Novena hospitals. He specializes in caring for patients through interventional cardiology and implantations of stents, a respected, renowned figure in cardiology circle. Dr. Nair has addressed many regional and international cardiology conventions, including the World Congress of Cardiology, and it feels very privileged, sir, to have you in the Ayurveda conference here today. Dr. VP Nair.
Thank you very much, and first and foremost, I thank you for inviting me to talk in this August audience. I was able to learn a lot from the previous speakers who talked about Ayurveda, which I know very little, because in Western medicine we do little knowledge, we have little knowledge about Ayurveda. But having said that, can I have first slides? I'm going to talk about the scope of integrated medicine in cardiology. I can see it here. And the next slide, I just want to compare the Indian medicine, Ayurveda, and the modern or Western medicine. Ayurveda, to my knowledge, is the science of the seers, evolved since thousands of years. The Vaidyas, or physicians, went in search of herbal plants, seeds and fruits to treat the sick. They also adopted physical means such as oils, heat and massage, which you heard just now, including Sirodhara, without funds, scientists or researchers to help them. They used in-depth knowledge to treat and cure illness. Whereas the modern Western medicine, even though it is around the same time, Western medicine has spread its wings into modern technology and innovation to prevent, diagnose and treat disease. Having been enhanced by scientists and researchers in laboratories and experimental arena, this form of medicine and surgical treatment have been a boon to the health and longevity. This has spontaneous effects on the sufferer, relieving them from disease and infirmity. Now, when you talk in terms of the Western medicine, you always talk about Hippocrates, who was born during the era of 460 BCE to 370 BC. BC means before the Common Era. That's a new term for BC. Observation of the patient is a vital aspect of medical care, he said. He did the systematic period of observation and the recording of what was observed, now known as clinical acumen or sometimes bedside medicine. Such idea led to Hippocrates being called the father of medicine. But having said that, I would like to look at Charaka, who was born 100 years before Hippocrates. He is the father of medicine, in fact. But why the Westerners did not know is because they did not know Sanskrit at that time. The language was the problem. He said that blood circulation by the pumping of the heart to various parts of the body, carrying pranavayu or oxygen, and returning of impure blood back to the heart. A great scientific statement. He also said, I read a little bit of Sanskrit in that talk, Falsang kocham vikasam cha sotakuriyal punaha. That means, I know a little bit of Sanskrit. Heart, even though I'm a Western doctor, heart contracts and relaxes by itself, thereby completing circulation, which is fantastic thinking. So WHO, the World Health Organization, in 1948, defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Charaka also wrote long ago, a physician who fails to enter the body of the patient with a lamp of knowledge and understanding can never treat disease. It is more important to prevent the occurrence of disease than to seek a cure. He said, Dharmartha kama mokshanam arogyam moolam uttamam. Health is a state, health is the root of ethical living, family and spiritual striving. What's the difference between the WHO statement and the statement done 500 BC? Now, another one, 600 BC, another one, 100 years before. Sushruta mentioned 300 surgical procedures and 125 instruments, maybe primitive, such as forceps, etc. His seminal and numerous contributions to the science and art of surgery, he is known as father of surgery. You can see this. This was taken, I caught this picture from Cleveland Clinic in USA when I was working there. Now, some of the pictures that you see here are the primitive instruments that he used. And this was produced by Mohopadhyaya from Calcutta. And I got this from, again, when I was in the Mayo Clinic in USA. But you look at these instruments in the green. These are the instruments used now to do rhinoplasty or reconstruction of the nose. But Sushruta used to do rhinoplasty those days without all this. Why? Why was the nose surgery important? I understand that in olden days, 600 BC or whatever it is, when people were naughty for whatever reason it is, they used to cut off the nose. And this guy used to put back by suturing. So that's interesting, actually. So that is how the ENT surgery started in the world. And you can see any ENT book, you will see it's Sushruta and Charaka in that mentioned. What about Ashtanga Hridaya? Another one by Vagbhata, 500 to 600 BC, a disciple of Charaka. Ashtanga Hridayam is a compendium of Ayurvedic system composed of Vagbhata, a systematized text of human illness and therapy in 6 sections, which incorporates the 8 branches of Ayurveda, including pediatrics, internal medicine, etc. This textbook deals primarily with therapeutics and adds some new herbs, new formulas, and advanced information on the use of metals and minerals. Sushruta, Charaka, and Vagbhata is the Trimurti or Trinity of traditional Indian medicine. Now, coming back to my specialty, that is cardiology, William Harvey, who lived between 1578 to 1657, is the father of cardiology. He was the first to discover circulation of blood. Harvey studied at the Cambridge University in UK and medicine at the University of Padua in Italy. At that time, Italians were pretty good in medicine. Obtained FRCP London in 1609. I did FRCP only many years later. Obviously, it is many hundreds, thousands of years ago. In 1628, in a book, An Anatomical Study of the Motion of the Heart and of the Blood in Animals, he explained how the heart propelled the blood in a circular course throughout the body. However, as I said, the Hindu physicians knew it long ago. Ancient Indian physicians have diagnosed certain heart diseases even by feeling the pulse. Now, what is heart attack? Heart attack may present, and now I come back to my specialty a little bit, then I'll go back to Ayurveda later. So it can present as a chest pain or tightness in the center of the chest, associated with sweating, heartburn, indigestion, even uneasy feeling, nausea, shortness of breath, cardiac arrest, and even death. Now, how can you distinguish heart attack from angina? Heart attack pains last more than 30 minutes to hours. The pain can be constricting, crushing, many types they describe, burning behind the chest. The chest pain can be usually on the left side, as you can see here, center of the chest, inner side of the left arm, left shoulder or throat, but occasionally it can be on the right side or even the jaw. So pain in the jaw does not mean that it is a toothache. It could be a heart attack. So you go to a dentist, you pull out your teeth, you may have a different problem. Of course, it could be due to heart attack too. Now, I show this particular person because this was in the Straits Times, and it was my patient who was only 28-year-old Indian guy who had a heart attack at the age of 20, which was long ago, 1986. He was initially treated with a bypass surgery. Subsequently, he had another heart attack, and he was treated by me with angioplasty and stenting, and he's still alive. He had all the necessary bad things in him, in the sense that he used to smoke, he used to eat a lot of things, he was a bus driver. So those days we had a bus driver and a conductor separately, very little exercise. Now, what are the risk factors for the heart disease? Well, you heard something from the Ayurveda Acharyas from now, but I tell you in a different way. They are modifiable factors, that is, factors that you can control. They are smoking, so if you smoke, stop smoking. If you don't smoke, don't start smoking. High blood pressure, treat it if you have it. You can't avoid it. High blood cholesterol and triglyceride, treat by dietary control, exercise, and medication such as statins. Diabetes, treat it. Overweight and obesity, you have to control it. Fortunately, I see very little obese people here. I'm very glad. Unhealthy diet, I'm sure we are going to have a lunch which will be quite healthy. Less saturated fat, trans fat, and sodium. Exercise, lack of routine physical activity, and stress. These are all modifiable, but what you cannot modify is age. You will grow old. Gender, men over the age of 45 and women over the age of 55, all of you are under that age. Family history of heart attack. Now, as far as the heart is concerned, there are two coronary arteries. One is the right coronary artery and the other one is the left coronary artery. The left divides into two, the left anterior descending and the circumflex arteries. These arteries can be blocked with various things. So when you have a chest pain, you take the physical examination, then you do some blood tests. Now the blood tests are to find out whether certain proteins are produced by the heart which is more pumped into the bloodstream. And the commonly one done is the CKMB, and the other one is cardiac troponin T. The laboratory will tell you what is the normal range and what you have, and from that you can estimate that whether the person had a heart attack or not. Of course, most important is an electrocardiogram. What is an electrocardiogram? It shows the electrical activity of the heart detected by electrodes attached to the chest and the limbs. Injured heart muscle doesn't conduct electrical impulses, and ECG will show whether you had a heart attack or what is the progress of the heart attack. Now you can see here sometimes, you know, the things that you can see here, certain changes in the electrocardiogram which can tell you that there is a heart attack. Of course, you can do a treadmill stress test if you got a chest pain, but you're not sure whether it is whether your heart is in good order or not. And there are certain changes you can find in the electrocardiogram when you do the treadmill stress test. There are other things such as echocardiogram, which is the ultrasound of the heart, whereby you can find out the heart muscle is weak or not, whether there is any problem with the heart muscle. You can also do a stress echo, whereby you can do an exercise stress test and do the echo again. There are some other tests such as nuclear tests, myocardial perfusion imaging, or maybe. I will not go into details because of the constraint of time, and I don't want to talk more than the time stipulated to me. But if you can ask me during the question answer time or later, I will tell you in detail. So nuclear test is important, and there is another thing called SPECT and PET. These are expensive, and these tests can tell you whether the muscle is damaged or not, and what is the problem, whether you need revascularization or not. Now, more important is, this one I'll go slow a little bit, cardiac computerized tomography or CT coronary angiogram. This is prior to this normal angiogram, whereby in a cardiac CT scan, you lie on a table inside a donut-shaped machine. An X-ray tube inside the machine rotates around your body and collects images of your heart and the chest, which is known as MDCT, multi-directional computerized tomography. There are many types in the world. The best is, of course, 640 slides, which we have it in the Mount Elizabeth Hospital. Now, coronary angiogram is the gold standard to find out whether the heart attack is there and whether you have to treat it with either angioplasty, stenting, or bypass surgery. An X-ray image is done to see the heart and blood vessels, the diagnosis and treatment of blood vessels. Special type of dye or contrast is visible by X-ray machine is injected into the blood vessel of the heart. The X-ray machine rapidly takes a series of images, what is known as angiogram, and it offers detailed look of the inside of the heart artery known as coronary arteries. Now this guy, Andrea Grunzig, is the first man who ever stents. The different types of stents. The older stents were not so good because you used to restenosis. The newer stents by various companies, particularly Medtronic, Resolute, Onyx, Abbott, Science Alpine, Absorb, which is a dissolvable stent, Boston Scientific Synergy, BioFreedom, which is one of the Singapore products, BioFreedom, and even Syntex, which is opposing stents in difficult cases. Now, apart from the stents, we also do certain tests whereby we look inside the coronary arteries by a camera, which is very minute, micro camera. And one of the things we do first is the IVUS, which is intravascular ultrasound, and you can find out whether the stent put is appropriate or not. If not, we can dilate it again and again. Now, recently we have started a new method like OCT, optical coherence tomography, which uses light instead of sound, and you can get a better definition of the inside of the coronary. It's just like looking through the telescope inside the artery or in the tunnel. In fact, we are the tunnel makers. So these are the various procedures that we do. As I told you, you can see in this picture. Maybe I show my picture so that you know where we do, whether it is US or India or Singapore, we all do the same procedure. Now, you can see here particularly, I think this is very important. You can see that the balloon expands and then it closes. When it closes, if it re-stenosis, we put a stent inside and it stays permanently in the coronary artery. And that particular video is good for you to understand how we do the balloon first, and then if needed, we put a stent, it remains nicely there. Now, what are the cardiac rehabilitation? After having done, this is where the Ayurveda and our Western medicine comes together. There is lifestyle modification to restore optimal social, physiological, psychological and vocational status of the patient. Progressive and incremental exercise improves peak functional capacity by increasing peak oxygen uptake. Low fat, low cholesterol diet and weight reduction. For this, vegetarianism is very good, except remove your ghee. If the vegetarian eat a lot of ghee, I understand. Smoking cessation, doesn't matter whether it is cigarette, BD, cigar or anything, all types of smoking are not good. Control diabetes by treating medication, but more important than medication is diet and physical exercise. Blood pressure control, again, low salt diet, medications. There are many medications which the doctor will tell you what to do. Maybe Ayurvedic medicine, maybe Western medicine, and of course stress management, which consists of the so-called yoga you said just now. The International Yoga Day is going on now, which is very important. And I also add meditation, meditation, exercise, yoga, and so on. So this is one of the things came in the Straits Times. Of course, my son is also a cardiologist, so we do together a lot of angioplasty and standing in Singapore. Now you see, this is a bypass surgery. Bypass surgery, we don't remove the block, but what we do is bypass the block. Of course, sometimes you have to do bypass surgery. So I said many years ago that when the car gets more attention, we spend a lot of money. You buy a Ferrari for millions of dollars, thousands of rupees or whatever it is to maintain it. But many of them refuse to take medication. So, which is more important, servicing the car or taking care of your own body? Go for a regular checkup. I said long ago and I repeat it again. So, what is the scope of integrated medicine in cardiology? TIM, this is a very important one. The traditional Indian medicine or Ayurveda, and TCM, the traditional Chinese medicine of Zhongyi, remain the most ancient yet living traditions in the world. Recently, there had been an increased global interest in traditional medicine. I heard from the previous speakers, people are flocking to India for Ayurvedic medicine, including Shirodhara, Nasyam and whatnot. China has been quite successful in promoting the therapies with more research and science-based approach with adequate funds, a lot of funds. Ayurveda needs more scientific research and funds. They are doing it very well. So they require more funds, and all of you should help for that. Both TIM and TCM has strong philosophical basis and could play an important role in new therapies, drug discovery and developmental process. It is very important to monitor and regulate herbal drugs and traditional medicine, because some of them can be toxins. Ayurveda offers a holistic, highly personalized, prevention-orientated approach, including diet, exercise, and many other modalities such as the Western medications. The International Accreditation Board for Ayurveda and Yoga to maintain standards in Ayurveda and its many subsidiary disciplines, including education, research, and practice, is certainly encouraging. It is heartening to note that India's Ministry of Ayush, I just learned only now, and Indian embassies worldwide are developing specific Ayurvedic programs for India and many other countries. Thank you very much.
And another question. Now lately, I am having diabetes also. It is 125 fasting and around 180 PP. My doctor says there is no need for medicine. It's okay with your age. These are my two questions, sir. Whether I should go for angiography or not?
Hello, can you hear me?
Yes, sir. Yes, sir.
Okay. Thank you very much for that question. 72 years old is still young. You're quite young. The reason is that the life expectancy in India, when I looked at it long ago, when India became independent in 1947, if I'm not mistaken, was very low, maybe 50 or 60, because people used to die of infectious disease. Similarly, the life expectancy in Singapore, when we became independent more than 50 years ago, was about 60 or something. Today, the life expectancy in India has crossed 65 to 70. And in Kerala, it is about 75 or something. In certain countries, certain states, it is low. The life expectancy in Singapore for women is 83, and for men, 80. We are one of the top 5. So why has it come up? Is it just because of angioplasty and stenting? The reason is not. Mainly because of hygiene and prevention of infectious disease. Because when the waterborne infections are controlled, many disorders like diarrheal disorders will come down. But coming back to your question of the second one, diabetes, for example, yes, when your sugar is a bit high, which is the case in your case, you can control it to a large extent by diet and exercise. But if it goes beyond 200 milligram, and so usually 170 something, it can be controlled by diet and diet and exercise. But I suppose you can control by diet and exercise, if particularly low carbohydrate diet and exercise. But if not, it is good to take some medicine. The reason is diabetes is one of the risk factors for coronary artery disease. And coming back to the second thing, if you got a chest disease, chest pain, etc., you can either do a CT coronary if you are not very prepared for the angiogram, then you can do a CT. Supposing you do an angiogram, if your block is say less than 70%, probably you don't need any stenting or anything. But if more than that, it is better to do angioplasty and stenting. So it depends on what you see in these two modalities of investigations. Is it okay? Thank you.
Hello, I'm Shivanand. This question is open to all of you, anyone who is familiar can answer. My question is, I saw a few slides where mentioned the trinity of Ayurveda, where 3 schools of thoughts were there who promoted the herbs and medicines. So my question is, like, most of the Ayurvedic medicines are herbs and minerals, and there are some medicines which are animal-based for specific conditions. Is it common through all the 3 schools of thoughts, or is it only in particular school of thoughts that later in the part of the time it became common to use animal-based products?
We made it in the first presentation that everything in the universe is potentially medicinal. There is nothing that is not medicinal. Everything can become, it is a contextual. And we have got 3 kinds of criteria. Medicines are divided into criteria: one, animal products, minerals and metals, and biological elements like plants. So the majority of the practitioners, southern side of India, use medicinal plants as the main resource base for medicines. But there are minerals and metals. There is a separate branch evolved in Ayurveda. There is a separate branch, separate science called Siddha, which uses minerals and metals as the mainstream medication. And the animal products are, there are 62 animal products are being used in Ayurveda, which are all needed for different conditions. So there is no question of this or that. Depending upon the condition, we have to use different materials for correction of imbalance in the system. Is that clear?
All the
Sorry,
all the three
just
systems
to
which you are
add to
asking
what you
about.
said, sorry. Okay, sir, please.
All you told about three peoples are there, like Sharakashura and Bhagbata, all have really emphasized and told about all this animal product, mineral product, and plant product.
The only exception is, of course, mercury was never used in the original three. Mercury was alien to India. It was brought only from Greece much later. And so mercury as a source of medicine was much later into Ayurveda. It was never used in the traditional three books.
I just want to add what they said. Yes, most of the medicines in Ayurveda are of plant origin. Animal origin include, of course, milk, which is a very important thing. So you can't say no animal origin. But in Chinese medicine, a lot of metals are also used. They used to use mercury and arsenic. Both are very toxic. So we, in fact, in Singapore, we also had to remove all these medications from time to time. So we are very particular that the content of heavy metals are very low in certain medication. Heavy metals can be bad. So we have to analyze. I'm sure the Ayurvedic medicine don't have much of a heavy metal for that matter.
I request Dr. Pradeep Dua to felicitate Dr. VP Nair.